you doing out there? You ever seem to have one of those days where it just seems like everybody's getting on your case, from your teacher all the way down to your best girlfriend? Well, you know, I used to have them just about all the time, but I found a way to get out of it. Let me tell you about it. Sitting in the classroom thinking it's a drag, listening to the teacher rap just ain't my bag. Noon bells ring, you know that's my cue. I'm gonna meet the boys on floor number 2. Smoking in the boys' room, smoking in the boys' room. Now teacher, don't you feel me? Up with your rules, but everybody knows that smoking ain't allowed in school.
And just push down real hard, really bad. Oh, that's cool. Yeah, you see how they like funny. Yeah, that's awesome. So then, all right, now try these ones. See how you're only getting part of the lungs are inflating. They're not inflating as much. They're kind of just shitty. Pretty much. Alright, now try these ones. See how you're only getting part of the lungs are inflating. They're not inflating as much. They're kind of just shitty. Pretty much.
But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while they have that cigarette.
Smoke, smoke, smoke that cigarette.
And if you puff yourself to death.
Hi, I'm DeVito28 and I recently quit smoking, and here are some reasons why I will never smoke again. Now, smoking is a habit shared by over 1 billion people across the world, and this has been practiced since as far back as 5000 BC. It was used by the shamans, and later on it was used by other religious groups. It was used as part of their rituals and their ceremonies. Smoking became a worldwide pastime by the 1600s. The English language term for smoking was coined in the late 1700s. Before then, the practice was simply referred to as drinking smoke. Now, the well-proven health hazards of smoking have caused many countries to institute higher taxes on tobacco and smoking-related products. Now, despite smoking bans, Europe and European countries still hold 18 of the top 20 spots, and according to the ERC, a market research company, the heaviest smokers are from Greece, and now the Greek are averaging on 3,000 cigarettes per person in 2007. Now, rates of smoking have levelled off or declined in the developed countries, but they continue to rise in the developing countries. Smoking rates in the United States have dropped. Now, they've dropped by half from 1965 to 2006, falling from 42% to 20.8% in adults. The connection between lung cancer and smoking was initially identified by German doctors during the 30s and 40s. This is contrary to the belief that it was discovered in the 50s by the British and Americans. Germany, under Nazi rule, initiated an anti-tobacco movement which had powerful effects worldwide. Adolf Hitler did not like tobacco, so this helped strengthen the movement. The University of Jena, headed by Karl Astor in 1941, was personally financed by Hitler. These pictures here are from the Rene Luft, which was the anti-tobacco movement journal, which contained propaganda cartoons linking smoking and cancer with the devil. Lung cancer is a disease that spreads uncontrollably through the lungs. There is a chance that the growth could cause metastasis. This is where the disease infiltrates tissue surrounding the lung. Lung cancer, the most common cause of cancer-related death in the men and the second most common in women after breast cancer, is responsible for 1.3 million deaths worldwide annually. The most common symptoms are shortness of breath, coughing and weight loss. Treatment and prognosis depend upon the histological type of cancer, the stage and the patient's performance status. Possible treatments include surgery, chemotherapy and radiotherapy with treatment. The 5-year survival rate is 14%. Breast cancer is a cancer that starts in the cells of the breast in women and in men. Worldwide, breast cancer is the second most common type of cancer. This is after lung cancer. 10.4% of all cancer incidents in both sexes counted, and the 5th most common cause of cancer death. In 2004, breast cancer caused 519,000 deaths worldwide. 7% of cancer deaths, almost 1% of all deaths. Breast cancer is about 100 times as frequent among women as among men, but survival rates are equal in both sexes. A month after being diagnosed with breast cancer, actress Christina Applegate, who's now 36, said she was 100% cancer-free. She said, "I'm clear, absolutely 100% clear and clean. It did not spread. They got everything out, so I'm definitely not going to die from breast cancer." She said, "My decision, after looking at all the treatment plans that were available or that were possibilities for her, the only one that seemed the most logical and the one that she was going to work for her was to have a bilateral mastectomy." Now, what causes cancer of the mouth and throat? In some cases, the exact cause of cancer is not known. However, the primary cause of mouth and throat cancer is smoking. People who drink excess alcohol are also at risk, and when mixed with tobacco, their chance of developing cancer is much greater. Another factor of cancers of the mouth, especially in the lips, is prolonged exposure to sunlight or sunbeds. This is also the major cause of skin cancer. Now, if you spend a lot of time outdoors, try to wear a wide-brimmed hat and apply a higher factor of sun cream to your face and your lips. Mouth cancers can appear in different forms depending on the area affected. Symptoms may include painless ulcer or sores in the mouth that do not heal, white, red or dark patches in the mouth that will not go away, earache, unusual bleeding or numbness in the mouth, a lump in your lip, mouth or gums, enlarged lymph glands in the neck. If the cancer affects the tongue, it may cause some slurring of speech. If the cancer affects the mouth, it may cause you to lose teeth or cause pain during swallowing or chewing. Dentists, when examining your teeth, often spot cancer of the lips and mouth. Make sure you have regular checkups at your dentist. Now, what are the symptoms of the cancer of the throat? The earliest symptoms of throat cancer are likely to resemble the same symptoms that you may experience with a chest cold. Symptoms caused by a tumour in the throat may include persistent sore throat, cough and hoarseness, pain or difficulty in swallowing, swollen lymph glands in the neck. They also include traces of blood in saliva, earache and nosebleeds. Now, the treatments that are available for this cancer, well, as with all cancers, the earlier the cancer is found, the better your chances are of effective treatment. The type of treatment you receive will depend on the type and the size of the cancer and your general health. Most cancers of the mouth and throat are treated with surgery to remove the cancer. The part of your mouth or throat you have removed will depend on the location of the tumour. An operation to remove the tumour may be all the treatment you need, but some people may also need radiotherapy either on its own or in addition addition to surgery. Now, chemotherapy may be used either in addition to surgery or the radiotherapy. Recent studies have shown that smoking increases the risk of impotence by around 50% for men in their 30s and 40s on the basis of these risks, and the Prevalence of Smoking in the UK, Action on Smoking and Health and the British Medical Association estimate that up to 120,000 UK men in their 30s and 40s are impotent as a direct consequence of smoking. This figure is likely to be an underestimate because some men have stopped smoking and they don't include that. Now, along with impotence, smoking can also lead to a reduction in the volume of ejaculate, a reduced number of sperm, abnormally shaped sperm, and a reduction in the response to any fertility treatments undergone. Now, the same process by which smoking causes diseases is responsible for erectile dysfunction. Erection problems in smokers may be an early warning signal that cigarettes are already damaging other areas of the body, such as blood vessels that supply the heart. Now, in addition to this, there is also an effect directly related to the acute effects of nicotine. Nicotine causes the penile tissue to rapidly contract as a direct effect of the nicotine on the brain, which in turn restricts the arterial blood flow to the penis. This phenomenon is referred to as acute vasospasm. However, as this is a direct response to the nicotine in cigarettes, immediate improvement is possible if smoking is stopped. You've seen the pictures and you've heard the facts. Now, smokers, think about what you're doing to yourself and your children. Your future is in their hands, but if you kill them, you'll have no future. Have a nice day.
But nicotine slaves are all the same. At a dinner party or a poker game, everything's gotta stop while they have that cigarette.
Smoke, smoke, smoke that cigarette.
And if you puff yourself to death. Nicotine slaves are all the same. At a dinner party or a poker game, everything's gotta stop while they have that cigarette.
Smoke, smoke, smoke that cigarette. Puff, puff, puff.
And if you puff yourself to death.
When you smoke, the chemicals you inhale cause mutations in your body. And mutations are how cancer starts. Every 15 cigarettes you smoke will cause a mutation. If you could see the damage, you'd stop.
But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while they have that cigarette.
Smoke that cigarette.
And if you puff yourself to death.
Oi! You over there. What's it like to have no air? You want to know something? Here's the dirty truth about smoking.
Go on. You want to fit in, don't you? Look at them all smoking.
But it's dirty.
You must be the only person around who doesn't smoke. What's the matter with you? It's just a little cigarette.
A little cigarette? Do you even know what's in it?
Here we go.
Don't you know nicotine is one of the most addictive substances on the planet? Even after just smoking a few cigarettes, your brain becomes so used to having it that it needs to keep on having it. And if you haven't smoked for a while, you get symptoms like being annoyed, bad-tempered and nervous.
So what? Everyone gets moody every now and again.
And what about tar? It's the same stuff which is on the roads, you know.
Whatever.
And that carbon monoxide stuff. It's a poisonous gas, you know. It's the same gas you find in car exhaust fumes. So even a small amount can't be doing you any good.
Oh yeah, I'm shaking in my boots.
But that's only half the story. There are over 4,000 chemicals in cigarette smoke, and 60 of them are known to cause cancer.
So, we all have to die someday.
True. But let's have a look at the effect it has on your appearance. Which girl would you rather look like? Do you want dirty teeth and nasty breath? What would you prefer your skin to look like? Beautiful, clear and clean, or greasy, spotty, oily skin? What about your hair? Perfectly straightened and very nicely styled, or greasy, oily, with split ends? And finally, fragrance. Very important.
But everyone's doing it.
Look, but that's not true. The reality is that only 9 in every 100 11 to 15-year-olds smoke regularly. That's only 3 people in your class. Not much, is it? So you might think that you're the odd one out, but you're not.
As if that's true. You're lying.
Who's been right so far? It has a massive effect on how you look on the inside as well, you know. Normally, oxygen's transported around the body to all the muscles and organs by attaching itself to the red blood cells. But when a smoker breathes in carbon monoxide, that also wants to be carried around in the red blood cells. Unfortunately, the carbon monoxide is stronger than the oxygen, and it easily attaches itself. As a result, the blood can't carry as much oxygen around the body and leaves you with less energy. The carbon monoxide can cut the amount of oxygen being carried in the smoker's blood by up to 15%. This means that the heart has to work much harder to get enough oxygen all around the body. The nicotine increases the rate the heart beats at and causes the blood vessels to narrow. This puts a strain on the heart. It also makes the blood sticky and more likely to clot and block the blood vessels, causing illnesses like heart attacks and coronary heart disease. Tar from cigarette smoke coats the inside of the lungs, just like it does on the roads. A smoker will inhale about 70% of the tar in the smoke, and this stays in the lungs, damaging the small hairs that help to clean them. An average smoker collects over a mugful of tar every year in the lungs. Smoking also causes cancer because cigarette smoke contains about 60 cancer-causing chemicals. When you inhale smoke, these chemicals enter your lungs and spread around the rest of your body. There are lots of other effects of smoking. I've only just touched the surface. If you still don't believe me, let's go meet someone.
I'm Christine Steele. I'm 64 years of age now, and I smoked from the age of 16 years to 44 years. So that's a good 20 years of cigarette smoking. My husband, he started smoking at probably 15, and he smoked until about 12 months or 2 years before he died. It attacked his spine. Then the cancer rapidly started to go into his lungs and his liver. And in the end, his lungs was so poor that he caught pneumonia, but they couldn't treat him. His lungs were so badly damaged. So they had to withdraw all treatment. And Alan died 2 days later. When my daughter came to visit him, she had started smoking again, of course, because of the trauma of Alan being so poorly. And before Alan became unconscious, he pleaded with her to give up smoking. And she made a promise to him that she would never smoke again. He was 65 on the Monday, and he died on the Saturday morning following his 65th birthday.
Are you sure you want to try that cigarette?
But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while we have that cigarette.
Smoke that cigarette.
And if you puff yourself to death.
If you're a smoker, I have a tip for you. Make a video of yourself before all this happens. Read a children's storybook or sing a lullaby. I wish I had. The only voice my grandson's ever heard is this one.
You can quit.
But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while we have that cigarette.
Smoke that cigarette.
And if you puff yourself to death.
For drugs or alcohol. Getting a handle on the trigger is the main thrust of drug or alcohol rehabilitation. And in the case of smoking, the culprit is nicotine. The buzz that nicotine gives you makes it habit-forming, and you may find it hard to give it up, even if you know it's bad. The secret of handling quit smoking withdrawal symptoms, then, is the knowledge that while nicotine makes you addicted, it's not the worst thing in the cigarette. It's the 500+ other substances in the cigarette that'll probably do that. This is what you need to know. What are the toxins in cigarettes that can kill you? Of the 500+ substances mentioned earlier, here are some that you may have heard about in other circumstances. Benzene, present in gasoline and some pesticides. The high levels of benzene present in cigarette smoke accounts for half the exposure in humans. Pesticides. Used on our lawns and gardens, it's inhaled through cigarette smoke. Eating organic food will not help much. Formaldehyde, a chemical used to preserve dead bodies. If you feel irritation in the nose, throat, or eye when you smoke, this is probably the culprit. Arsenic. Commonly used as a rat poison, arsenic, the pesticides used in tobacco farming, may still be present in your expensive pack of cigarettes. Carbon monoxide. Ever popular, this substance from car exhaust that has been the subject of much public outcry is also present in high levels in cigarettes. Hydrogen cyanide. Used to kill people in the World War II by the Nazis. While the cast of characters is incomplete, I think you get the picture. Knowing what you're sucking up every time you light up should give you pause. Nothing is more off-putting than preserving your body before you die.
But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while we have that cigarette.
Smoke that cigarette.
And if you puff yourself to death.
Well, you seem happy today.
Well, why shouldn't I be? I have the two things that would make any man happy. A gorgeous wife, and I'm smoking a Kent.
Which do you like the best?
Now, there's a tough one. You see, for cooking and for dancing and kissing, you satisfy best. But for filter and taste, Kent satisfies best.
I'll accept that.
But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while we have that cigarette.
Smoke, smoke, smoke that cigarette. Puff, puff, puff.
And if you puff yourself to death. But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while we have that cigarette.
Smoke, smoke, smoke that cigarette. Puff, puff, puff.
And if you puff yourself to death.
The Flintstones has been brought to you by Winston, America's best-selling, best-tasting filter cigarette.
Winston tastes good like a cigarette should.
They sure work hard, don't they, Barney?
Yeah? I hate to see them work so hard.
Yeah, me too. Let's go around back where we can't see them.
Gee, we ought to do something, Fred.
Okay. How's about taking a nap?
Hey, I got a better idea. Let's take a Winston break.
That's it! Winston is the one filter cigarette that delivers flavor 20 times a pack. Winston's got that filter blend.
Yeah, Fred. Filter blend makes the big taste difference, and only Winston has it up front where it counts. Here, ahead of the pure white filter. Winston packs rich tobaccos specially selected and specially processed for good flavor in filter smoking.
Yeah, Barney, Winston tastes good like a cigarette should.
But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while we have that cigarette.
Smoke, smoke, smoke that cigarette. Puff, puff, puff.
And if you puff yourself to death.
The other function it has is memory. Now, individuals who smoke marijuana, the drug goes directly to the part of your brain that is responsible for you remembering things, both past events and current events. And the problem we have here is that that's certainly true when you use the drug in the short term, in other words, when you're intoxicated by it. Unfortunately, people who use the drug for years and over time develop permanent memory impairments in the ability to function in terms of remembering past events. Now, this has a direct effect if, in fact, you're trying to do any kind of high-level or important type work other than, for instance, labor-type work. So if your future goals are to be involved in activities and jobs that utilize the function of memory, it's probably a good idea not to use that drug. There are certain things marijuana just doesn't do to your judgment and your memory and your brain. It affects your general health. And I think it's important to understand what those things are. For instance, that's a picture of a carcinoma of the esophagus that you get from smoking hot vegetable matter, hemp, that is to say. It's not a good idea to put hot things down your throat and into your lungs. We know that from smoking cigarettes. 3 marijuana cigarettes are approximately equal to a package of cigarettes because of the high tar content. There's 50 to 70% more carcinogenic compounds in marijuana than there are in tobacco, and we know that tobacco is dangerous. But that kind of example is something that is a cancer that comes from smoking hot vegetable matter, and not a good idea. Yes?
In relation to its carcinogenic quality,
Yes.
how is it just the tar that makes it carcinogenic, and where does the tar come from?
Well, the tar, good question. The tar is present. For instance, like in tobacco smoke, there's tar. The tar comes from the thickness of the resin in the plant itself. So when it's smoked, that resin goes into a gas form, goes from the liquid form when you smoke it to the vegetable matter, becomes a gas. Then when you inhale it and the temperature cools in your lungs, that tar precipitates and comes back out of the gas into a solid. So it goes into the smokable part and becomes heated, and then when it cools in your lungs, it precipitates. That's the tar aspect of it. There's also interesting problems with people who have other illnesses. For instance, people with heart disease. When you take the drug, it increases your heart rate when you're just at rest, sitting, by about 20 to 30%, and your heart pounds. Anybody with any sort of heart disease, it can precipitate heart attacks in them because of the increased work of the heart. People who have blood vessel disease, perhaps in their brains, it increases the risk of strokes in individuals who take it because of the increased heart rate. Individuals who have lung disease, now obviously if you have asthma or a chronic cough, and certainly if you smoke cigarettes as well, adding the increased tar and carcinogens that are in cancer causing stuff that's in marijuana smokes only increases that. So if you have, you know, it's kind of like this. When you smoke this stuff, you cough up big green goobers. And it can lead to coughing up a lot of them if you continue to smoke it over time. And it's clearly associated with lung disease in individuals.
But nicotine slaves are all the same. At a pen party or a poker game, everything's got to stop while they have that cigarette.
Smoke that cigarette. Puff,
and if you puff yourself to death.
I'm John C. Dvorak. The show is Generation X3, where one baby boomer is pitted against 3 nasty millennials to discuss the topics of the day. What? Marijuana doesn't harm lung function, study finds. Smoking a joint once a week or a bit more apparently doesn't harm the lungs. Suggests a 20-year study that bolsters evidence that marijuana doesn't do the kind of damage that tobacco does. You came up with this story.
I didn't come up with it, I found it.
Is this why you stopped smoking tobacco?
No.
He doesn't smoke weed.
I don't smoke weed at all. I don't do any drugs. But
who here smokes weed? Anybody? Ever?
I don't think anybody's going to admit.
Not like you're acting. Well, we're in California, so it's not really illegal necessarily.
I have.
You have?
I've been known to.
No.
No, you?
I never thought. I thought the surfers of the world never smoked anything.
I'm gonna drop a bombshell here. I think Dorian does. Is this true, Dorian?
My mom
Have you ever
watches
smoked
this
pot?
show.
She does. After some of the stuff you said on this show, I'm sure you can just show a secret.
Okay, Dorian's mom, she doesn't smoke pot.
Dorian doesn't do anything bad.
No, I don't know if she does. But okay, this is stupid.
You never smoked
Why
pot
is
I
this
think
stupid?
that these scientists here have been smoking a bit too much pot. Because, okay, smoking a joint once a week does less harm than smoking cigarettes. How many cigarette smokers do you know smoke 1 cigarette a week?
Nobody. But
Exactly.
But that's not the point. The point is that it's not bad for you. And
Because it's au natural.
whatever.
It's tobacco. Give me a break.
No, it's not.
It comes from the earth.
No, I mean
They don't
tobacco is
put-
not.
Tobacco is the same thing.
But
It's
not
all
when you have a
natural.
cigarette.
They put all kinds of
Not if
Yeah.
you're taking, you
stuff
grow
in
your
it.
own tobacco.
Well, who's
Yeah,
gonna
but
grow their
who
own
does that?
tobacco?
We don't live in
And then
Georgia.
you roll it yourself.
It's just a stupid comparison. It's apples and oranges. No one smokes one cigarette a week.
No.
No one.
So you think this is a, what would you call a specious argument?
Yes.
Bogative.
Absolutely. 100% specious.
I would think probably like it's like smoking one joint a week is probably less than secondhand smoke that everybody else gets.
Yeah, he's
Yeah,
probably right
true
there.
enough.
Yep.
Yeah, probably, maybe.
We should just.
So this whole thing is a
Yeah.
meaningless crap.
I think that these guys don't have anything to do, and they've been doing this for 20 years.
Who is
They've been
paid to do
studying
this
these guys
for 20
years.
People
I'm going to
from-
smoke pot for 20 years.
Yeah. I think we know some people that have been smoking pot for 20 years. None at this table, I might add. All right, we'll wrap that one up. You've been watching Generation X3.
But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while we have that cigarette.
Smoke, smoke, smoke that cigarette. Puff, puff, puff.
Even if you puff yourself to death.
Let me cover quickly a few physical problems with marijuana. The average marijuana joint will contain anywhere from 3 to 10 times as much tar as a typical cigarette. Now, it's tar that contains the ingredients that lead to cancer, emphysema, chronic bronchitis, all of which are more common in the marijuana user. There's no doubt, scientifically it's been well proven, that marijuana users have a much higher incidence of chronic bronchitis. You hear them coughing all the time. A much higher incidence of what we call chronic obstructive pulmonary disease, which is a fancy medical term for emphysema, which just basically means the lung tissue is breaking down. They can't move air back and forth as readily. And there's even a growing body of research that shows it can increase the odds of developing lung cancer. That's not 100% yet, but there are studies coming out of Chicago and California which are very, very strong in that direction. Plus, when you look at the chemical ingredients of the tar in marijuana, which, by the way, the marijuana user doesn't call tar, they call it resin. When you look at that ingredient list, it's very similar to tobacco and contains the same carcinogens or cancer-causing agents as tobacco, and in many cases in a higher percent or a higher quantity than you would find in tobacco. So right away we have the problem with regular use of marijuana causing lung damage, possibility even of lung cancer. The resistance to infection, therefore, in the marijuana user is reduced. It affects the immune system. And in today's world, where there are many new contagious diseases which we're getting less and less good treatment for, that could become extremely relevant. It also points out why we see things like bronchitis so much in the marijuana smoker. Not only does the smoke and the tar irritate the lung tissue, they don't have the ability to fight off the infection that you would normally see. So now we have two common physical problems to worry about with grass. One, the effects on the lungs, and two, the general effects on our immune system and our ability to fight off infection. Another area of the brain that marijuana tends to concentrate in is what's called the hippocampus. That's a technical term for an area of the brain. What's important is that's an area of the brain that is profoundly important in memory, especially in recent memory. And more studies are pointing that marijuana usage causes profound impairment of recent memory. Well, that's the memory we use for learning. What we frequently will see, therefore, for instance, is, let's say, a youngster who starts smoking some grass in junior high or high school and starts by the time they're in their junior or senior year to be a regular user of marijuana, we see a definite progression in the deterioration of their academic performance. They can't remember things as well. Actually, in the chronic user, this leads to what's been called the amotivational syndrome. This is an individual who really has to focus on the here and now. They really only have an interest in if you want immediate gratification. Let's try to put some of this together. We have a drug that accumulates in the brain over time, slows up the brain through its reaction with the marijuana receptor and with the thickening of the cell wall of the functioning brain cell, affects things like fine motor control, eye movement and tracking of a moving object, peripheral vision, coordination, memory, learning, etc., etc. And let's try to illustrate how that affects a human being in a day-to-day situation. A simple experiment that has been done with marijuana versus alcohol, I think, can illustrate this. If you take a person and you sit them down at a table and there's a light that goes on, and as soon as that light goes on, they have to hit a switch. You can time that and see how various drugs affect it. Well, a couple of drinks, a couple of beers, a couple of mixed drinks, a couple of glasses of wine will really slow down a person's reaction time to that light and switch. Joint of marijuana will slow it down, but not nearly as much as alcohol. It's really quite minimal. But if you make the situation a little more complicated, a little more complex, example, red light, a green light, and a yellow light, and you have a red and a green and a yellow switch, and you now have the person smoke some grass and you time them, and you say, look, when the red light goes on, hit the red switch, the green, the yellow, that will be significantly more slowed down than if it was just one light, one switch. If you make the instructions even a little more complicated, such as when the red light goes on, hit the green switch, the green, the red, the yellow, well, now we've got different parts of the brain that have to interconnect. They have to learn what you just said. They have to have coordination between their eyesight and their thinking and their logic and their fine motor control. A bunch of different connections have to occur in the brain. That kind of response to a more complicated environment, a more complicated input of things, will slow it down even more. Now let's take that into a real-life situation. There was an excellent study done a number of years ago on professional airline pilots. They put these gentlemen in a very sophisticated flight simulator used by the Navy to train their pilots. And they had them land this flight simulator at 10 different airports. And they measured how they did doing that, how they handled coming down, their altitude changes, the angle of the planes called the attitude, the use of different flaps and such, and how close they hit on the center line of the runway. They then had these gentlemen who were not marijuana users, they had been tested to be clean, smoke a joint, and tested them some 20 minutes after smoking the joint, 1 hour, 4 hours, 12 hours, and 24 hours. I don't want to go into all the technicalities of that, but what was really shocking was that as long as 24 hours after using, they were significantly impaired at this complex performance of flying an airplane. Many things were measured, but the one that was easiest for me to understand, not being a pilot, was coming down on the runway towards the center of it, towards the line down the middle of it. And even 24 hours after using, the pilots landed 2 times as wide. They had 2 times as much leeway from that center line as they did when they were straight, which was the control situation. Put that in other terms, if when they hadn't been using, they landed left or right 10 feet of the center line, when they had been using 24 hours after use, it could be as far as 20 feet left or right of the middle line. So the performance was significantly impaired. The scary part was every one of the pilots thought they performed better at the 24-hour after the last joint test. We have a drug here that may have very limited medical benefits for terminally ill people, people with cancer, possibly with AIDS. And I would be the last person to want to deny the use of that drug for those purposes. I think that could be done in a very controlled, regulated manner. But we also have a drug that's very dangerous. It causes damage to lungs. It can possibly lead to something as serious as lung cancer. It impairs the immune system and the ability to fight off infection. It has profound effects on the functioning of the brain, on your perception of the passage of time, on your abilities to learn. I think frequently many kids are dropping out of school because of their use of regular use of marijuana. And some of these kids even get labeled as learning disabled and attention deficit disorder, when in fact it may just be a drug-affected behavior. It has a lot of detrimental sides to it. And for that reason, I feel it should remain an illegal, highly controlled substance with very limited, highly regulated medicinal uses.
But nicotine slaves are all the same. At a fun party or a poker game, everything's got to stop while they have that cigarette.
Smoke that cigarette.
Even if you puff yourself to death.
More advice. Real life, no bullshit advice. Hey, I smoke. Can I still bodybuild? What's the effects of smoking or smoking marijuana?
Hell yeah, you can smoke. I suggest in between sets, light one up in the gym. Take you a couple hits of that bitch, you know what I'm saying? Blow smoke all in the gym, man. Hell yeah, you can still build muscle.
Hey.
Fuck no, you can't build no muscle, man. Smoking cigarettes, man.
Yeah, smoking cigarettes. Those have a lot of added carcinogens in it.
That shit causes cancer. That shit doesn't build muscle. That shit kills your ass.
Yeah, so smoking, you know, it affects the way your abilities to breathe. If you can't fucking breathe, man, you can't put forth the effort in the gym. If you can't put forth the effort in the gym, you ain't gonna get no results.
And y'all have noticed that people smoke. You might see a uncle or your dad or, you know, someone that you're close to that smokes and they're outside playing with the kids and look like they're gonna fucking drop dead. It's because their body can't fucking breathe.
They
right.
can't process oxygen good enough.
Yeah.
I mean, a resting heartbeat of a smoker beats 30% faster than somebody who doesn't smoke.
It's not good, man. So you put those two and two together, you go in the gym, man, his fucking heart might pop.
Yeah. So,
how about marijuana?
Well, marijuana is not as toxic as tobacco smoke, but it's still fucking smoke. You breathe smoke in, it fucks your lungs up. If you can't breathe, you can't work out properly. You can't work out properly, you ain't gonna build no muscle.
Yeah, marijuana and cigarettes is totally two different things, though. I mean, if you had to pick between the two, which one's healthier? Of course, marijuana, but it's still gonna, in the long run, it's gonna fuck you up.
Yeah.
If you're not that type.
If you're serious about building muscle, you wouldn't do either.
Yeah.
You know, but
that's our advice on it. But hey, y'all do what the fuck y'all want to do.
But nicotine slaves are all the same. At a dinner party or a poker game, everything's got to stop while they have that cigarette.
Smoke that cigarette.
Even if you puff yourself to